World Vision's Development Programme Approach. Our world is plagued by poverty and injustice, and children are often the most impacted. Nearly 9 million children under the age of 5, 24,000 per day, die every year from preventable diseases. And the World Bank estimates that 2.8 million more children could die from health-related issues in the next 4 years unless immediate actions are taken. Other threats to children's well-being around the globe include trafficking, lack of education, and hunger. Urgent assistance is needed as poverty continues to deny children their basic needs and erode their dignity and rights. This is the world in which we are called by God to act and make the world a better place for children. We take this calling seriously by continuously learning and improving our approach to development. This presentation illustrates the basic principles of World Vision's Development Programme approach, which has evolved over the years. Our approach builds on the existing strengths of our programs, and this video emphasizes good practices that you can use as you develop programs. As you review the video, think and reflect on how these practices can be used for your specific situation. Apply the guidance flexibly and creatively to make an even greater contribution to the well-being of children. Let's start with several key ideas that are fundamental to our development approach. Our programs focus on the well-being of children, especially the most vulnerable. In our programs, we work with local partners and communities to improve and sustain the well-being of children. We seek community participation and ownership in all aspects of programming. Local staff members who live in the communities and develop good relationships with people are critical to good development. Staff have the freedom to innovate. In the next few minutes, we'll cover 3 areas that are foundational to our development work. What is child well-being? How do we contribute to child well-being? And how are local staff and their work supported in communities? Child well-being is the focus of our development programming approach. We describe our understanding of child well-being through child well-being aspirations and outcomes. Under our 4 high-level aspirations, we have 15 operational outcomes for the well-being of children that guide our strategies and programming choices. From these 15 outcomes, we have derived 4 child well-being targets. All the outcomes areas are important, but we have chosen 4 to start with that reflect priorities from our national and regional strategies. Over the next 3 to 6 years, we will measure the impact of our programs toward these targets. We will focus on these 4 targets. Children report an increased level of well-being. Increase children who are well-nourished. An increase in children protected from infection and disease. And an increase in children who can read by age 11. Your programs should contribute to those child well-being targets that are prioritized in your national office strategy and relevant to your community context. A few other points to remember as we work towards improving child well-being. We must intentionally include the most vulnerable children. If we do not, these children get left out. Work with communities to identify and include the most vulnerable children and their families. In programs with child sponsorship, we make sure registered children are among the primary participants and beneficiaries. We select children from communities where we plan to have program activities and children who are in the correct age group to benefit from the activities. How do we contribute to child well-being? More and more, We contribute to child well-being by working with partners. We engage with partners to develop a common vision and a common set of priorities for child well-being. In many areas where we work, community leaders and organisations existed before World Vision arrived, and they will probably be there long after World Vision departs. So we want to partner with these people to focus and collaborate on setting and contributing to local child well-being priorities. Who are these partners? They could be community-based organisations, the government, churches and other faith communities, and businesses. They may be formal or informal groups. Why is partnering so important? Working with partners increases resources for children and thereby makes a greater impact. By partnering, we also build local ownership of the work. This ensures child well-being will be sustained after we leave. Our relational approach to working with local partners follows something we call the critical path. This consists of 8 steps to help World Vision staff work with communities and partners towards child well-being. The critical path can be used throughout the life of a project or program as staff and the communities learn together. It's the duty of governments to provide essential services to citizens, including education, healthcare, and basic public safety and protection. But in some communities where children have urgent needs, there is little or no government or civil society able to provide these services. In such contexts, World Vision will begin to take a more direct role in delivering services, but only in a way that models and promotes a well-functioning government and civil society. Let's cover a few more points about our programs. Committed volunteers are important. World Vision and partners are increasingly working with volunteers to help improve child well-being. We support them through training, coaching, and showing our appreciation. They aren't volunteering for World Vision. They're volunteering for the children in their communities. We have developed project models that bring together globally recognized good practices in health, education, child protection, and other sectors. This is important because project models guide the design of projects and are applied with flexibility and in context. Advocacy is a critical component of our development approach. Our staff supports communities and partners as they work with government and other authorities to advocate for the rights and well-being of children. We empower communities to make sure government and other authorities deliver on their promises for child well-being. We help communities and partners take ownership of a plan for reducing disaster risk. And if disaster strikes and our help is needed, we work with partners, including government, which plays an important coordinating role. Something else that's essential to effective development is our local staff who live in the communities. The relationships they build with people are the foundation for World Vision's work. Our work is all about relationships. Our staff seek God's presence and help through prayer and reflection, and through listening to children, the poor, and partners. Our staff engage in regular reflection and learning with communities, and this improves the quality of our work. Let's review some key ideas for World Vision's approach to development. Every World Vision program works toward child well-being. The way we do this is by working with local partners and engaging with communities. Programs are developed through this partnership and are owned by the local community. And we value local staff for their ideas, skills, and the relationships they build with the people we serve. we have developed a brief overview guide called World Vision's Development Program Approach that provides further details on the material highlighted in this video. It is available along with other resource materials to help you at wvdevelopment.org. We hope this gives you a good start as your team works toward making the greatest possible impact on the well-being of children. May God bless you in following this calling.